I'd like to welcome you today for our breakfast meeting on day 3 of Arab Health. We are particularly excited to host you here this morning, and thank you for taking the time so early to come and see us. Before we begin this journey to precision medicine, I would like to spend some time with you to give you an overview of our M42 group, because this is a special, one-of-a-kind health powerhouse. So our tagline, what we stand for, as you may have read around the booth today and in the past occasions here at Arab Health, we stand here because we are at the intersection of innovation and health. And I'm using on purpose the word health and not healthcare, because we want, of course, to focus much more on what technology can do to really transform health, well-being for our patients. And M42 is actually the coming together, the recent merger, which happened June last year. So it's a 7-year-old entity, which came from the consolidation of 2 different streams. One is the G42 healthcare vertical, a data and AI company, right? Ready to transform healthcare, and Mubadala Healthcare, with the collection of premium, world-class patient provision services, which are really diversified and transforming provision here in the UAE and in the Middle East. And ultimately, this comes together with the intent of leveraging, enabling with the use of technology, right, bridging the gap with ultimately what matters the most, which is patient outcomes. That's what we stand here today to engage with this, with you, international audience and diversified stakeholders this morning. But let's go one level down, right? Like any company, we have a vision, we have a mission, right, of delivering world-class patient-centric care. And as we said, move beyond healthcare, moving into prevention, into prediction, into personalization. Yeah, and our values, and I think that's witnessing ultimately the diverse audience that we have today with us. We believe we can do it with the help of our partners. Yeah, we are a very ambitious group. We have the aspiration of growing internationally, and we can do it together with our partners. Our partners being technology providers, being data-centric technologies, being laboratory technologies, being labs throughout the world with whom we can partner to really provide this level of service from here, and also as a cascade also into other different hybrid models. Let me go one step down to give you a brief overview of the different elements of M42 Health. So as I said earlier, from a Mubadala Health standpoint, there are a variety of clinical assets, patient-facing assets, with some well-known, internationally renowned brands such as Cleveland Clinic Abu Dhabi. And we have here the head of oncology, Professor Steve Grossmeyer. Thank you for being here today. With the likes of Moorfield Eye Hospital, Abu Dhabi. We have Imperial College of London Diabetes Center. We have Diaverum, which is the 3rd global provider of renal care, which is now part of the group and has a presence in 26 countries. So we can officially say that M42 is an international group with more than 450 clinics around the world. We have a national reference laboratory. We have a various surgical specialty center of excellence as part of the groups, ranging from, obstetrics, gynecology, bariatric surgery, right? We have one of the region flagship oncology center just open, just to witness also our intent to transform also how our cancer patients are being treated. And below that, just as you see, all the range of technology applications, which in a way power our patient or care provision. And these services, they range from digital health platforms, powering the Health Information Exchange of Abu Dhabi, also known as Malafi, right? We have other platforms for consolidating all financial claims, right, for the same patients. We also have, and that's the topic of the day, our large, high-scale, high-capacity Omics as a service lab, which is a large facility, around 8,000 square meters, just to give you a flavor, yeah, of space which is dedicated to omics, moving from population genomics, which was the inception of our G42 healthcare journey with the Emirati Genome Program, now branching, now evolving into clinical with our CAP accredited lab, which are already delivering, as we speak, a range of clinical genomic services to hospitals in Abu Dhabi. And this is a great transition because all of these capabilities I'm describing are all local. So have all been implemented in Abu Dhabi, in our labs, to ensure that we can offer to patients the best quality service that they deserve. Beyond that, and we have here the leaders of this organization, we also have a contract research organization, which is called IROS, which has been the first UAE homegrown contract research organization, which branched to the fore with the pivotal trial for humanity during the pandemic, right, which ultimately led to the registration of the Sinovac vaccine with WHO. That was a pan-Arab trial involving 40,000 plus participants from all over the Arab world, which was a fantastic feat, which led to an amazing publication. And we also have, as part of our portfolio companies, our environmental sciences lab. Our medical director should be in the audience. And this is quite a unique offering because we are partnering with the Department of Energy and the Abu Dhabi Quality and Conformatory Council to operate labs which test everything that comes in contact with us as human or the environment, such as food, such as water, such as drugs, such as cosmetics. And this really supports the ambition to provide monitoring services, surveillance services for a variety of applications. So infectious diseases, pollutants, industrial pollutants, substance abuse, and other pathogens which may be relevant to different entities. And these labs, they represent state-of-the-art capabilities that we have established with the intent of providing these unique services to the government and ultimately offer the same to other customers. So whatever we have as part of the portfolio basically was initially conceived and established to deliver on these local services, but the ambition was, or is today, even more so within the M42 group, to offer the same as a service. And this is why, in this transition into multi-omics, we believe that all of these capabilities are extremely relevant, right, for a variety or a collection of new clients. And the clients indeed are represented here in this audience this morning. They can range from other governments, they can range from payers, they can range from hospital groups, pharmaceutical companies, referral labs, and ultimately also with our GenSense offering, also direct to consumers, right? Because there is an important element of the genomic application for healthy individual and consumers. As I was describing before, our multi-omics, which is referred as a center of excellence, is sitting in Masdar City, Abu Dhabi. It is one of the largest lab probably worldwide, right, in terms of, yes, square meters, but most importantly in terms of capacity, throughput, and having as part of the platforms available, the top 3 probably, different platforms offering genomic sequencing, ranging from long read to short read. And with that, all the necessary infrastructure in order to support the workflow end to end. We have internalized all of these processes in order to ensure data residency, data security, storage for the next generations, right? And also the ability to not just generate the digital data, but also move into interpretation, moving into the science that we can extract from the data, ultimately to deliver value to the end user. Yeah? And all of those capabilities have been localized in the UAE, right, as a flagship project within the Multi-Omics Center of Excellence. The advanced diagnostics is the step forward because Multi-Omics was created for a population genomics purpose, which is a research project, which is the EGP, the Emirati Genome Program. We are the partner, the execution partner of that program, most likely one of the largest population genomics program in the world. Today, where we stand after about not even 3 years since the start, we have crossed the line of 500,000 participants sampled, sequenced, and interpreted whole genome sequences, which makes in itself, right, a treasure trove of information. Treasure trove for clinical actionability, for policy making, and also for research purposes. And this is really a unique facet of the life science hub that the Emirate of Abu Dhabi is putting together, is facilitating really to transform healthcare for Abu Dhabi, for the UAE, and more broadly for the world. I will close with this one slide, which is in a way summarizing the type of customers that we serve. So as I said at the beginning, most of the things that you have seen since the beginning have been catered, have been organized for the Abu Dhabi government. However, the same processes that now have been high-scaled, high throughput, you know, with the highest level of data security and data quality are now ready for prime time for many others. And this is why, in fact, our team is heavily involved into conversation with different governments, different payers, different hospital groups, pharmaceutical company, right, and ultimately patient/consumer themselves. With that, I will pause. I thank you for your attention. I will turn it to Albara Elkani. Albara and I work very closely. He's our Senior Director of Operation, who will go much more into the details into the journey towards precision medicine. Thank you very much.
Assalamu alaikum. Good morning, all. That's a lot of information to digest, but I think just as a summary from my perspective, what M42 is doing today, I believe, is at the cusp of a paradigm shift within health. Again, to Francesco's point, it's not healthcare, it's health and well-being. If we're able to detect, predict disease and well-being prior to it actually causing a clinical manifestation, then that in itself is the massive success. And the way to do this is to utilize the information and data that we have available to us as M42 as a network. Data is becoming one of the most powerful tools that we have today to support our patients, our population, and our citizens. One of the key data elements that we have, or sources that we have, which is driving innovation, driving therapeutics, and driving well-being, is the genomic data sets. We're very fortunate at M42 that we have the largest, or if not the largest, one of the largest genomic data sets in the world. We have the Emirati Genome Program, flagship program, that has an aspiration to achieve 1 million whole genomes, the entire population. That's a very fortunate position to be in. In the first 3 years of this program, bearing in mind this was during the peak of the pandemic, building this laboratory that Francesco is referring to, one of the largest genomic capabilities or multi-omic capabilities in the world, also collecting, building awareness across the population, that the population themselves volunteer these samples that they will benefit them in the long term. And we've so far reached 570,000 voluntary samples, but more importantly, we've sequenced all of these samples. And the transition from a research program into a impactful, insightful, diagnostic utilization of this data set has been the quickest transition globally seen. If you compare to any other population genomic program in the world, typically it is research driven. Insights are driven for helping and supporting precise clinical therapeutics. But we're very fortunate at M42 that very early on, within a year and a half within this program, we were able to take this program into a screening prevention program as well as a diagnostic program. And we'll describe some of that journey as we go through the slides. So again, I think this pyramid here depicts really some of the key components required for us to build that precision medicine, prevention, well-being led approach. The phenotypic clinical information, all our hospitals within M42 networks, EMR records are enriched with so much data sets. It's just about how we use these data sets to predict risk, also to prevent disease and conditions. But more importantly, if you couple that with the genomic data sets, so now you're linking phenotypic, the clinical records, with the genotypic data sets. And you can, the sky is there's no limits to what you can do with that. That phenotypic, genotypic correlation allows us to build insights, novel findings, and new precise clinical therapeutics. This is an innovative change because what we're doing here today is really able to bring the entire network and connect it with the genomic data sets that these patients have. So this flywheel or this information here really just talks about some of the vision or strategies or applications of this genomic data set, leading into a precise way of treating patients. Now, I would like to maybe take you on a journey throughout this prediction, prevention, precision buzzwords that we hear. These words are used very flippantly, in my opinion, when really the context behind these words is very critical. The journey I see, at least in my head, is a patient, before they're born, we understand the risk of disease. And how you do that if you have the genomic data of the parents. So we understand now that if there is a potential for a rare disease to happen in the offspring, that gives them a common disease carrier state. So that in itself gives you a prediction that 25% chance this child will have this disease burden. So the question is now, how do you build clinical workflows to allow you to manage that patient? So one of the key elements is now to give fertility-related clinical workflow. So now you're able to bring this couple, have potentially a healthy offspring, and now you've reduced the burden of disease prior to actually happening. That's in the sense of prediction and prevention. Then a baby is born. So at this stage, you collect a sample, the baby's mother consents for the Emirati Genome Program sample. You have now given a genomic passport for that baby for its entire life. The genomic data changes in one instance, but in somatic disease burden, but we'll build on top of that in this journey. So this patient now has a blueprint, a genomic blueprint, a passport they walk around with that can be utilized over and over again. So now this child grows up, becomes an adult, and what we can do now, we start sitting there on the genomic data, and with the new research and development, we start looking at prediction, polygenic risk scores. That's an element where we're able to really predict potential disease or the likelihood or the risk of this disease from happening. So when you now predict prior to this disease happening, and it could be a disease that was not discovered in the early days, but because you sit on this genomic data that can be analyzed over and over again, you now can manage this disease way in advance. So that's sort of a journey that I see, that constantly as you interact with that individual and that passport, that genomic passport, you are reducing the risk of disease exponentially throughout this journey, ultimately leading to a much healthier environment. And that's just on disease burden. Now, if we look at well-being and wellness, there's a lot of research out there today that talks about the correlation between your genome and your well-being, be it mental, be it physical well-being. So there's a lot of elements that we can depict from the genomic data sets that will allow us to really help that individual. But what's more important is decentralizing this data. Giving the patient the power to understand their genomic data is one of the most refreshing elements of this program. Giving them the power to utilize this data set for their benefit, their well-being, their improvement in life is really a game changer for us. Any other population genomic program has not led to the genomic data being provided back to the patient in some simple, interpretable manner. Applying our AI tools, M42, to help interpret these complex data sets, but in a very simple format, is a game changer within clinical genomics and well-being in genomics. Even clinical genomics today is a very complex report that requires expertise to understand and interpret. But using these tools and analytical tools that we've developed allows it to be simplified and brought to the patient in a seamless fashion. So that really depicts what I just described. There's ways to look at the whole genome sequence. There's ways to look at specific panels, targeted panels. Also now where we are moving into a new advanced way of genomics where we are now predicting disease or diagnosing disease through what we call the liquid biopsy, or in what I call the liquid gold. A very simply drawn blood sample that now predicts potential cancers. Instead of, we have Dr. Grabmaier here who's a specialist in this area, but I'm sure he will reiterate, instead of us going and taking a tumor or a biopsy from a tissue sample to diagnose a disease, you can constantly collect blood samples and through the blood itself understand the genomic makeup of a potential cancer, and therefore you can treat it very early on. And more importantly, you can subtype this cancer to have a precise clinical therapeutics. So now you're treating not just the cancer, you're treating the individual with the cancer with the right medication that will work for that individual. That's where we get into precision, if we fail with the prevention. There's another story to this, or another twist to the story. So that was the genomic journey. But what we also know is that our environment affects our physiology, our diseases, and not just the genomic data. It's how that translates what we call epigenetics, or your protein makeup. So one element is proteomics. And the key driver here is there's many sort of proteomic applications. The methodology of proteomics has been established for years. But really where the revolution has changed in the past few years is the data that's produced, the panels of proteomic markers, 7,000, 10,000, 11,000 protein markers, and the algorithms that have been built to understand the correlation of these markers to disease and link them to clinical burden has been really the innovation that's happened in the last few years. So if you imagine this journey of a genomic blueprint being established from birth, and then on top of that you have a proteomic annual screen where you can predict and understand from your protein markers the potential of having that disease, and way before it becomes a clinical manifestation. For example, it's been shown that in type 2 diabetics, if you were to do a proteomic screen, you can predict cardiovascular episodes like myocardial infarction 4 years prior to actually happening. Because why? The protein markers are developing way before the clinical condition is developing. So the genomic data set plus the protein data set, you combine these data sets, these become very powerful. Link it to the clinical insights, then you start building these AI algorithms that start building correlation between clinical manifestations to genomic novel findings to proteomic markers. That in itself becomes a game changer in the healthcare and health. You're now able to support the patient on delivering well-being, understanding how the environment impacts their health, but being precise in that, because it's very generic. Eat better, do more exercise, and so on and so forth. But if you're able to really precisely say, if you do X and Y, this will impact your health exponentially, then there's a potential for you to really drive health and well-being from early on in someone's life. So I just described what we talked about, the cardiovascular disease and the myocardial infarction. We're working closely with our colleagues at Imperial College London Diabetes Centre to prove this in a clinical domain. Because it's been proven in other clinical domains, but within our patients, again, this is one of the unfortunate things, is most of the clinical therapeutics that's available out to us today is based on reference genomes and based on clinical trials from a specific ethnicity. So we know that there's a big drive in the FDA today to diversify our ethnicities within our clinical trials. So it's critical to us to actually prove these methodologies and technologies within our own population, to ensure that what we're using in our population works for our population. Again, taking a precise approach to clinical work and medicine. So I'd end on that note. I hope you enjoyed the journey through the genomic sphere and what we can do to improve people's health, well-being, and reduce the risk of burden. I thank you so much. I'll pass on now to Dr. Pranab. Dr. Pranab is leading gastroenterologist, but got a keen interest in microbiome. And that's another key element. I think the microbiome has a massive impact on health and well-being, and Dr. Pranab will describe that. Thank you so much.
Thank you, Albra. Welcome, everyone. I'm a gastroenterologist, so what my task is going to be is to demonstrate to you all this technology that's being developed by M42. How am I using it in my day-to-day practice? That's one thing I'm going to tell you a little bit about, but I'm also going to then tell you a little bit about where I see this heading in the future, because it's a fascinating topic which is really drawing a lot of interest, a lot of research in. So within gastroenterology, the top condition I see is something that's very common worldwide. About 10%, 20% of the population suffer it at some point. Is irritable bowel syndrome, a common condition which really wasn't very well understood up until recently. So this is a condition, for those who are not familiar, where there's symptoms of bloating, abdominal discomfort, where there's no underlying explanation, or at least we thought there was no underlying explanation. So a couple of years ago, there was a big study, 5,000 patients, randomized controlled meta-analyses, which is basically a combination of different studies, which showed really at the heart there is some disruption in the gut microbiome that's resulting in these symptoms. And what's more, they showed that certain bacteria or probiotics helped with these patients' improvement in their symptoms compared to some of the commonly prescribed medicines that we were using up until now. So taking that forward, what we're seeing a lot of growth of, as you can see, is probiotics and all of that. And within Dubai, I've analyzed all the probiotics. You've got about 70 different types of probiotics with all these different bacteria being promoted. But utilizing this, the test, the gut microbiome test that we have now access to, really gives me a profound idea of individuals who present to me with this condition to tell me exactly what is going on, what is the disruption that I can see within their GI tract. And then I can advise them on the appropriate probiotic that they would benefit most from. So this is something that I'm doing in day-to-day practice. I can talk to you a little bit more about other conditions where there's a quite profound disturbance in gut microbiome, which is now increasingly acknowledged by both the societies in the UK and US, for instance, in inflammatory bowel disease. Again, we're going to see a lot more utility of microbiome analysis in guiding really individualized nutritional therapy in these conditions, far more than just giving a kind of a standard dietetic advice of eating this and that. It's really guided towards being precise about what's lacking in certain individuals, what's excess in terms of the bacterial load within that individual. Now, just that's my day. That's what I use in gastroenterology. That's what I'm doing, and I'm utilizing this. But I want to tell you a little bit about where I see this going forward. It's fascinating. In diabetics, for instance, there's a really good evidence where a huge study analyzing about 1,000 diabetics, their gut microbiome, feeding that into an AI algorithm. Participants then monitored their blood sugars over a period of time and saw what particular foods was doing what to their gut microbiome and their blood sugars. So this AI algorithm that's been created, and I think which I'm working on here, is trying to get a patient who comes in through the door, have their gut microbiome analyzed, with the AI algorithm interpreting that person's individual microbiome individually, giving you a really much more precise dietetic advice. And the evidence so far, which I've seen, and it's fascinating, is that the dietetic advice given knowing your gut microbiome is far more effective at controlling your blood sugar than that which you would get from a doctor. Now, that's just the start of it, and I think we're going to see a lot more of this precision nutritional advice, precision targeted probiotics in individuals, guided by analysis of gut microbiome. And the technology behind it is really advancing and helping us get better at giving precision advice. I think I can carry on about another area which is really interesting, sports medicine, for instance. Now, a few years ago, there was a really good, I'll end on the sports medicine aspect. A few years ago, there was a really good trial in the Boston Marathon runners, which was looking at the gut microbiome of these marathon runners to see how they performed. Now, the top performers had a particular bacteria that was really interesting. Why were they having a lot more of this? And they analyzed this particular bacteria, and they found that that particular gut microbiome bacteria called Veillonella was actually utilizing the lactic acid that runners obviously produce a lot of, and burning it and actually producing butyrate, which is some fantastic metabolite which the body needs for your muscles to function really well, top performers. So they took that one step further and laced it into a probiotic and fed mice. And the mice that were fed that just on its own were able to run 13% longer. Now, this is a fascinating trial, but you'd think, well, where does it go? Yes, it's being utilized. It's actually in practice, in production, and being used in athletes looking for precision medicine. What is their diversity within their GI tract in terms of this particular bacteria, and raising that threshold to improve their performance. So these are just examples of how we're utilizing these precision medicine, precision nutritional advice, guided by results from tests, the gut microbiome tests. And I think that's what we're doing here, and I think you'll see a lot more of it in the future. Those are just examples, and there's a lot more, but I'll stop over there because I think time is limited. Thank you all.
Thank you so much, Dr. Pranab. And I particularly had a very fascinating panel discussion with you yesterday, looking all at gut microbiome. All of our speakers are super approachable. Please do enjoy the refreshments and ask more questions about M42's Omics capabilities. Before we end this particular business breakfast special presentation, I'm going to invite Albara and Francesco back on stage for a lovely group photograph. Thank you very much. And ladies and gentlemen, give them all a big round of applause.